good afternoon. Hello, everyone. This is Representative Dan Miller. Thank you so much for joining us for our penultimate Lunch and Learn, our August Lunch and Learn series that we've been doing to talk largely about Medicaid. We've also talked about SNAP. We've also talked about some of the education questions that have come up, all due to actions by the federal government that have caused some degree of concerns or questions to arise. As we have discussed over these several sessions, Medicaid in particular is a state federal government partnership to make a lot of things work, and it's not something that was easily created and crafted and applied, and it's not something that's easy to take away without ramifications. Obviously, the information we're providing is the best that we have at this time. I'll be honest, I kind of hope that I would be satisfied to see things change from the federal government. I am concerned. I never felt that we were maybe meeting all the goals of Medicaid before the last couple months, and I'm not quite sure we'll be meeting them afterwards. So, but we're going to wait and see, and obviously our hope is to provide you information. So hopefully you've been able to work us into your lunch hour here with a little snack. Again, our goal is always to be right around that 30-minute mark to be sure people get some little downtime. Don't forget, all of our videos during this series will then be closed captions and put on our website at repdanmiller.com. The links can be shared. You can come back and watch it, whatever you need to do, but we'll be sure the presentations and the discussions are on the website for you to use at a later time. So I want to get right into it because we actually are working in 4 guests today. 4 guests. So let me first tell you who we have with us today, and then we're going to get right into it. So some of them are reoccurring favorites, so we're glad to have that, but we also have a couple new faces too. So Dr. Josie Badger is president of J. Badger Consulting and executive director of Peacock Consulting, which work to ensure people with disabilities have a full range of opportunities. One of their current projects is called Save Medicaid, where they are partnering with the state to create safeguards for the most vulnerable populations. There's Josie. There she is. She's always great. Erin Gabriel is with us again. She is the government affairs representative for the Pennsylvania Health Access Network, PHAN. PHAN is Pennsylvania's only statewide consumer-driven organization working to expand and protect access to high-quality, equitable, affordable health care for all Pennsylvanians. There's Erin again. Glad to have her. Thank you so much. Erin Gay is the co-director of the Pennsylvania Health Law Project, a statewide nonprofit legal aid organization. PHLP has been do you say that in a way, or do you just say PHLP?
Just PHLP.
Okay. All right. I wasn't sure how to work that. PHLP has been helping Pennsylvanians navigate the Medicaid program and understand and exercise their legal rights for more than 30 years. I want to thank the Health Law Project for being here. Erin, thank you so much. And our final presenter today, certainly not least, is Christy Bean Rowing. Christy Rowing is the Director of Development and Governmental Affairs for St. Clair Health, which for those of you who are familiar with my district in particular, St. Clair Health is St. Clair Hospital. Obviously, they've continued to grow in footprint and access, and they are an incredibly important local resource for us here in the South Hills and beyond. But St. Clair Health is a highly honored 329-bed independent community hospital in the South Hills of Pittsburgh. New to the role, she is the last person in her family of 5 to enter the healthcare field, and St. Clair Health has been involved in so much of what we do. They've long been a sponsor of our Disability and Mental Health Summit. They were our first and carried the ball for many years, along with our great friends over at Bethel as well. So St. Clair has been a fantastic partner for our office. We appreciate them sharing their expertise with us today. And the whole topic, so thank you, Christy. The whole topic here, what we wanted to get into was the importance of Medicaid in relation to hospital systems and long-term care. So it's a little bit different, but I'm telling you, it's very integral. So we were very glad to grab 4 people who know this subject area a little bit better than clearly better than I do, so we could all learn together and get a little bit of idea of how important it is for the federal government to keep its promise. The whole point in relation to our questions of Medicaid is sizable reductions, if they are to occur, are not something that will be easily backfilled by the state. Largely will not be possible, and there will be ramifications for that. And our hope has been to make sure that people don't fall needlessly through a bureaucratic hole, and that systems are more resilient not that systems are further strained in providing services to Medicaid populations in particular. So that's why we're here, and to help us understand what's been going on and a couple things that you should know about, we're going to start first with Erin Gabriel. Erin, please.
Thanks, Rep. Miller. Hi, everybody. Thanks for being here again. Erin Gabriel from Government Affairs for the Pennsylvania Health Access Network. I just kind of wanted to give you all a kind of a primer for the rest of our conversation so you understand where these cuts are coming from. I've got my daughter here singing in the background, so that's to entertain you. But essentially, there have been some federal changes on how the state can operate something called provider taxes. This is a set of taxes that the state taxes the hospitals, they tax managed care organizations, so insurance companies, and they tax nursing homes as a means of then taking that money, kind of bundling it, and sending it back to rural hospitals in particular, or nursing homes that may need a little help, and things like that, so that money that the hospitals and the insurance companies pay to the state is then redirected as state-directed payments to the hospitals and to the nursing homes that need it most. So what we're going to be seeing is we're expecting that about 600,000 people in Pennsylvania are about to lose their health insurance through a combination of changes that have impacted access to Medicaid. We're expecting about 320,000 people to lose access to Medicaid. And we're also expecting 270,000 people to fall off of the penny marketplaces. We were talking about those changes earlier in the week. That combined change in insurance status for so many people is going to be harmful to hospitals because you will have people showing up without insurance who cannot pay their bills, and that's called uncompensated care. We're expecting about $706 million a year in new uncompensated care that hospitals will have to deal with somehow. But in addition to that, the change in these provider taxes is actually going to hurt the hospitals as well. Medicaid doesn't pay the full cost of care, if you will. When a hospital puts in for reimbursement, they get about 80% of that back from Medicaid. And if you have a high rate of Medicaid patients in your hospital, you're basically just not making enough to make ends meet. So the way the state compensates for that is they take these state-directed payments and they send it back to the hospitals that need it the most to make sure that they can stay afloat and keep providing that care. When they do that, the federal government matches that payment through what's called an FMAP. And that money comes into the state government's budget and is redirected towards the hospitals, but also towards other Medicaid programs. So the short story here is when we are changing how these provider taxes are done, which is what is happening right now, the state of Pennsylvania is going to lose between $2 and $4.5 billion each year out of our annual budget. And that is money that would normally go to Medicaid programs. So the changes are a prohibition of new taxes or increases to the amount or rate of existing taxes, which sounds great on paper, but in Pennsylvania, all of our taxes sunset and then have to be renewed. So there's the likelihood that we will not be able to renew our taxes, and all of those provider taxes and all that money that comes in from those provider taxes would then not be available to us for Medicaid programs. A prohibition on non-uniform taxes. Pennsylvania has a waiver so we can tax a larger hospital at a different rate than a smaller hospital, for example. Philadelphia hospitals have one rate, whereas rural hospitals have another. That is going to go away as well. And we're one of 8 states in the country that will be most affected by that. And a lowering of the actual rate that we are allowed to charge in taxes. And again, we're one of 22 states that will be most impacted by that. So of all the states in the country, we're one of the most impacted by these changes. And what that means is that the state is going to have to find a way to make up between $2 and $4.5 billion a year out of the state budget. And that could be less payments to the hospitals. It could be coming out of schools, roads, bridges. It could be raising taxes, but most likely it is going to come out of the very Medicaid programs that we are trying to protect. And a lot of that is going to be programs like our waiver services, like home and community-based services, which I know a lot of folks on this call are most concerned about. So that's sort of just setting the stage for you. I'm going to let my colleagues talk about the direct impacts on each of these areas. But just so you understand that these changes in taxes is how it's being phrased, and it's very confusing. It really amounts to just a cut. It's just a massive cut in federal dollars coming into the state for Medicaid. So I will hand it off to Christine, who can talk more about the impacts on hospitals directly.
Thanks so much, Erin. And I just want to shout out to Rep Miller's team and this process, because as I've sat on these for the past few weeks, I personally am learning something every time I'm on these calls. So thank you all for hosting us. It is a tremendous service for sure. I do want to piggyback a little bit on what Erin said, because what I am hearing, the more I learn and the more I am in the community, is people think that this is a unique situation, that this partnership and fund matching is unique. And I just really want to make sure that everyone understands that this is not something that is unique to Medicaid or Medicare. This happens with your highway dollars and gas tax. This happens with your school taxes. As a collective unit, the state of Pennsylvania needs to bundle these funds for a whole host of other programs, and that's how the federal match comes in. Now, obviously, we're talking very specifically about medical care, but this is something that is been used across the board, across different states, across different sectors, and it is a powerful tool in the tool chest of being in the business of government. I think that's really important to understand. When you donate something to your local PTA, your $20 isn't building the playground. Your $20 is being bundled with lots of other $20, and then probably getting a match from a foundation, and then submitting for a state reimbursement. This types of bundling is how we provide care for the people around us and the people that we live with and care about very much. So I just want to make sure everyone understands that this is not new math or old math, as the case may be, but this is a mechanism that has been used historically. Why these changes are so important, and I would be remiss if I didn't start out by saying this is, and I think I speak for every hospital in this Commonwealth, is if you need care and you walk into an emergency room, you will get care, regardless of who your provider is, who your insurance is, who your if you're a private pay, you will get care. What happens after you receive care is what our job is to figure out, and how to pay for those services. At St. Clair, our goal was to provide exceptional and compassionate care across the board, regardless of a person's situation. So I just really want to highlight that, and I'm going to highlight it again at the end because that's so important to know. Why we're concerned about this is really the people and the programs that see the highest usage of this is in maternal health, as well as mental health, because what we know is that if you don't have access to regular care with a provider of choice, and you have some continuity of care, we will see people showing up to deliver babies who maybe haven't had any prenatal care all along. That puts the mother and the baby at greater risk. We want people who need mental health support to have regular check-ins with a provider to help manage medications, to help reduce the likelihood of an adverse situation. Those things are really important and will be directly impacted by lack of access to care. Chronic conditions that without regular care will see an increase, will become harder and more expensive to treat without that care. And that ultimately diminishes the impact of the care that someone receives if you don't have, excuse me, the regular care along the way. Healthcare has high fixed cost. Our job is to make sure, regardless of our balance sheet, is that our supply closets are stocked, that we have the equipment needed to provide the services, and that our staffing levels are up to par. And St. Clair is committed to that. But with these cuts and across the board, we will have to adjust for that in a way that will be profound. On an organizational level across the state, please also keep in mind that hospitals are still recovering from COVID, so it's not like we have tremendous savings and war chest built up over the years. You know, most of us are just getting back on our feet, coming out of a very challenging time for the entire world. So that puts us in a weaker position in terms of absorbing these costs. I think everyone would agree that the rural hospitals may feel this first, and that puts them in a vulnerable place. And then what happens when those rural hospitals can't provide care? Do they close or discontinue service lines? And then all of a sudden you're traveling an hour or maybe more to receive care. That also impacts the quality of someone's care. Instead of driving 15 or 20 minutes or having to pay for medical transport to go, 60, 70 miles, that's a tremendous burden on the consumer for sure. By some estimates, we think that there are 30% of hospitals in this state that are moderate or severe risk of needing to reduce service lines, or in the worst case scenario, close. 51% of hospitals in the state of PA currently operate at a loss. Those numbers will become more significant and come across that way. And I'm getting, I feel like I've talked too much, but I do want to leave you with one really important thing. Please stay engaged at the state level. As Rep. Miller said, the funding mix will probably need to be adjusted. Please talk to your providers if you have concerns about your access to care and how it affects your ability to manage your condition. And again, if you need medical assistance, please don't let these changes keep you from seeking medical care in the emergency room, be it St. Clair or any of the other hospitals. Okay. Sorry if I went over.
I believe that I am next on the roster, but hello, everyone. I'm Josie. And what I'm going to share with you is a little bit about the potential impact of what we feel the cuts could look like for folks with disabilities, whether they're receiving Medicaid based on their disability and low income, or whether they use Medicaid buy-in or medical assistance for workers with disabilities. I had the great privilege of speaking with DHS Secretary Valor Kush last night. And, although repeatedly we heard from the feds that there were no cuts directly to people with disabilities like Medicaid and Medicare, that just won't happen because of the sweeping cuts across the state. The state is going to have to make some very difficult decisions around what they can keep and what are other things that are so important to the state that they might have to cut some services. We know for sure that previously for individuals that were becoming eligible for Medicaid, Medicaid was able to pay for 90 days prior to eligibility of medical care. This is going to be cut to 60 days. And so that could really increase medical debt, which is such a problem in America. We know that even for folks on Medicaid waivers, there is a chance that some of these services will be cut. And so right now they are asking for input around what are those key services that Medicaid and home and community-based services provides that allows folks with disabilities to live in their community, live in their homes. We also know for folks who use Medicaid and Medicaid buy-in but are disabled, the work requirements are going to become more of a problem. The reporting is going to be a problem. And so right now we are looking at where are these potential gaps and what are ways that we can elevate the most critical aspects of waivers of Medicaid for folks with disabilities. But these are still all on the table, folks. So I'm going to turn it over to Erin Gay.
Great. Thanks, Josie. Nice to be with everybody today. Thanks, Representative Miller. So just to end the discussion again about just kind of the funding cuts and the impacts that this will have across the healthcare system, just wanted to focus on the long-term care system in Pennsylvania. Medicaid is the primary payer of all long-term services and supports in the US and in Pennsylvania. Medicaid pays for 59% of nursing home residents in Pennsylvania. It pays for home and community-based services for more than 190,000 older adults and people with disabilities. So when the Medicaid funding is cut through the provider tax changes, through some changes to state-directed payments, when people lose coverage, it shifts costs to the states, and it could mean that there's more of a demand on the long-term care system when people don't get the care they need, they get sicker and may need long-term care services sooner than they would otherwise. So right now, if someone needs long-term care services, if they need help bathing and dressing and moving around, mobility issues, skilled nursing maybe, if they qualify for Medicaid, they have a choice of getting the care in a nursing home or in a home and community-based services waiver program. And so I think the concern is, will services be cut like Josie mentioned? Will home and community-based services be cut that help people with those daily care needs that they rely on? If those services are cut, there'll be greater demand on nursing homes. And will nursing homes, will we see nursing homes close because of these funding cuts? Will we see nursing homes maybe be more resistant to taking people with Medicaid because of the changes? So we want people to still have that choice, right? When they need long-term care, we want the system to be available for them. We want them to have the choice between facility-based care and home and community-based care. And if people choose to be in a nursing home or need to be in a nursing home, we want them to get quality care in the nursing home. And right now there's lots of challenges with understaffing. There's lots of challenges that can impact quality of care in nursing homes. And another change in the federal law, they stopped the implementation of some crucial staffing protections for nursing homes that were supposed to take effect over the next couple years. So with those changes and with those rules not going into effect, again, that can impact the quality of care and safety of residents in nursing homes. And I guess just the final, Josie mentioned the shortened retroactive coverage period, and we think that that could potentially impact people's ability to access Medicaid in nursing homes. Again, maybe nursing homes won't be as willing to take people that aren't already on Medicaid who need to apply for Medicaid and get approved. With the 3-month retroactive window, they're more likely, it takes time to get all the paperwork together to get the application submitted, knowing that they can get reimbursed for the couple months prior to the application being submitted. When there's a shortened window, the concern is that, again, this will just impact nursing homes' decisions whether to accept people that need to apply for Medicaid once they get there. And then I think just the reality is, I think people that work in nursing homes that provide care to our older adults, people with disabilities, a lot of those folks rely on Medicaid and SNAP. And when these benefits are being cut, will that impact their ability to keep working as many hours as they do? Will that impact, their ability to stay in those jobs, or will they have to kind of find jobs outside of the long-term care system due to the low wages and the burden that they're going to have now to continue to get the Medicaid SNAP benefits that they rely on? So I think there's just a lot of ripple effects that these changes can have across the whole healthcare system. And I think that's what we wanted to highlight a little bit about today. So I will turn it back to Representative Miller.
Yeah, thank you. Thank you, everybody. And you can see, look, it gets a little bit complicated with a couple things here. And again, that's because, well, some could say that, of course, the American healthcare system has always had its complications. We'll leave that discussion for another day. But the challenge, of course, here is that how can we make sure a bunch of Pennsylvanians who have a chance to continue to have coverage and to get coverage don't lose it due to mistakes that they make in relation to paperwork, but also don't lose it because systems aren't strong enough and that the Harrisburg and DC are not doing their job here of making these systems work. So that's going to be the challenge for us. And look, as we kind of go through, we know that a bunch of these changes won't come into place till after the midterms. Again, I'll leave that for another discussion as to why certain changes don't come up until after midterms, but there are changes that are coming. And we're going to continue to pay mind to them and to raise the issues up in a way that hopefully can better prepare everybody for them and for Harrisburg also to learn more. I learn a lot and take notes as we go to try and understand it a bit better too. Thank you to all four of our presenters today for sharing their expertise on this topic. We have one left of our August Lunch and Learns, and that is on next Monday, August 25th. That will be solely on SNAP, and there we go, SNAP and the Charitable Food Network. So please join us for this very important discussion here. So that's going to end it. I think that's 5 on Medicaid and SNAP, 1 on education. So I think that's probably 6 that we're going to get done here before the end of August, which is tremendous. It's only because we have people who share their time and expertise with us and my staff working with them to be sure that it is a great program, which they have been so far for sure. Don't forget on repdanmiller.com, not only can you join us live for when these things broadcast, I think 3 of them are up there right now. The 8.6, the 8.11, the 8.13 are up there now currently, so you could see the previous Lunch and Learns there. The other 1 or 2 are on the route. They're all going to be up there probably somewhere by Labor Day. They'll all be done, where they'll all have closed captioning, they'll all be available, and they'll all be easy for you to loop back on, double check the information, or share it to people who you think might be interested as well. So all that is still to come. We're not done yet. So again, I want to thank Josie, Aaron, and Christy. Thank you all for joining us today. I know for some people it's been multiple times. We really appreciate you for making the time, and we'll hope to see everybody on Monday, August 25th. Bring your lunch, 12:15, repdanmiller.com. We'll see you there. Thank you.